And there we go. And we will put this webinar on our website in the coming days. At the end of this presentation, we'll also have some time for questions. And so please do write your comments, do write your question in the chat so we can address these. If we don't get to your question today, I promise we will address those questions and we will send an email with answers to all those who participate in this meeting. If you want to use AI live translation today to listen to the webinar in your preferred language, you can do so by clicking on the Wordly link, and my colleague Alice will put the Wordly link in the chat in a few minutes. And I think that's all for all the items that I wanted to cover. I would like to hand it over now to our chair, Beth Frederick, to share a few remarks and thoughts about our new strategy and the exciting work that's ahead of us. So over to you, Beth.
Thank you, Veronique, and hello, everyone. It's a privilege to present to you the Reproductive Health Supplies Coalition Strategy 2535. It represents the best thinking of all the members of the coalition and presents an action plan that is certain to serve us well in the decade ahead. Since the coalition's formation, we have undoubtedly been part of considerable progress made for sexual and reproductive rights. Yet that progress has been uneven and is increasingly under threat. Take just one example. Despite reductions in maternal deaths globally from 2000 to 2015, the trend stalled from 2016 to 2020. In a few countries, the rates were particularly high, and in nearly all countries, access to services and supplies reflect economic disparities, discrimination, displacement and conflict, and insufficient progress toward universal health coverage. Growing political and financial uncertainty have compromised the wide range of issues that the RHSC addresses, and our work is increasingly compounded by humanitarian crises, the aftermath of the pandemic, and shifts and strains in the public and private funding environment. But I have faith in all of you, all of us. RHSC was born because of a similar set of challenges, and there is an urgent need and huge potential for the global community to think and act nimbly. RHSC offers transformational leadership to guide us through this minefield of shifting priorities, and no single agency or individual can do it on its own. The RHSC 10-year strategy offers a global blueprint to address exactly what we need today. It's a clear, compelling roadmap that will help us to transform markets through improved data visibility and use, diversify financing for reproductive health supplies, bolster manufacturing capacity in low and middle income countries, drive price reductions in reproductive health supplies, increase the supply and demand for safe and effective products, advance country and regional ownership of supply chains, and above all, champion gender equality. RHSC's new strategy emerges from a year-long, highly participatory strategy redesign process. It lays out an ambitious yet realistic vision and 4 strategic objectives that our community cares most about. To address those objectives, the strategy defines the unique pathways and outcomes that the coalition will pursue and achieve by 2035. It also clearly acknowledges that no single institution or sector can ever meet these supply challenges alone. Above all, it acknowledges the effectiveness of a global coalition with decades of cultivating transformational partnerships in service of a common vision. That vision is as essential now as it has ever been, ensuring that every person can choose, access, and use high-quality supplies at every stage of their lives. This is your strategy. It's our strategy. There's no doubt that we will seize the opportunities our coalition laid out for our collective action. I hope you're as inspired as I am by RHSC Strategy 2535. Now over to you. Back to you.
Thank you, Beth, for this introduction. Again, we're thrilled to present to you this new strategy. I hope that you're able to find some time in the coming weeks, if you haven't done so already, to familiarize yourself with this document. So this past year, the RHSC completed an ambitious redesign of its strategy for the coming decade. The process relied on an independent review of the ecosystem and significant input from more than 440 coalition members who contributed their time and their perspective and ideas towards developing this document. The resulting strategy is grounded in what has worked well over the years, and we'll get to that in a couple of slides. It's also responsive to the current needs and the challenges and opportunities in the landscape. It's informed by continuous tracking of outcomes that capture the change that we hope to see in 10 years' time. And finally, it's really clear on how RHSC will achieve its aim, its objectives, and ensure collective efforts to achieve the priorities that are delineated in this document. Our hope is that our members, that all of you here today will see yourselves in the strategy, understand how to take it forward. The document and the way it's laid out makes it easy, we hope, for members to decide where they can commit themselves to by providing them a menu of ways in which they can engage. So we are getting ready to roll out this strategy with your help. Today, we'll discuss what is new and what's exciting about this document and how to put it into action. But before, next slide, please. Before we dive into the document, I wanted to take a step back a bit and answer the question, why did we embark on this refresh of our strategy? So both our current strategy, which we launched in 2015, and our 4-year funding cycle are ending in 2025. So to prepare for the next 10 years, in the fall of 2022, our advisory board, so the executive, asked the Secretariat to begin the process of reviewing, revising, and redesigning its strategy. Towards that end, starting in the spring of 2023, with the help of a consultant team, RHSC embarked on a highly participatory redesign of its strategy that relied on 90 key informant interviews, on an online survey of our membership that returned more than 290 responses, as well as input from an advisory group that we established for that purpose. This advisory group comprised 22 people that range from supply chain actors across sectors and geography, half of which were based in LMIC. We had manufacturers, procurers, we have members of civil societies, as well as every members of our structures, so the working groups, the caucuses, the regional forums, including the structures of the VAN that participated in the working group to provide really feedback on the process and on the products. We also held some consultations and many meetings, including during our GMM in Accra, Ghana last year, where we engaged our members in a visioning exercise during plenary, and we also solicited input from members during that meeting, during the side events and side IM meetings. So in the end, the redesign of our strategy delivered 3 products. It delivered a review of the RH supply landscape to better understand the changes that have occurred in the ecosystem, in particular since 2019, which was the date of our last landscape and after COVID. We also delivered a forward-looking review to better understand RHSC's past achievements and also its challenges and the implication of these for our future work. And finally, we delivered this document, this strategy 2535, that reflects a coalition where it is today in the rapidly evolving landscape in which it operates and the role it will play going forward. Next slide, please. So in the following slide, we'll walk you through the document, highlighting what is new and what stays the same with this new strategy. Overall, in terms of structure, you may have seen that the document gets to the core of the RHSC in the first half of the document. We get to the vision, the mission, the strategic objective in the first pages. Other sections that deal with the operationalization and the implementation of the strategy, so the levers of change, the guiding principles, our transformational leadership, the tracking of the implementation of the strategy, all these sections comes in the second part of the document. So to discuss what's new, I will hand it over to Martin Smith. Over to you, Martin.
Thanks so much, Veronique, and really appreciate your wonderful opening remarks as well. Beth. And so great to be with everybody. Just want to check, want to get a couple of thumbs up from people that you can see the slides properly. I see our colleague Arne Fitzer was struggling to see the slides. Are everyone else okay? Put a thumbs up or in the chat. Let us know that you can see them all right. Yep, good. Thanks, Ben. All right. So Arne, we're gonna one of the team's gonna be in touch with you. Make sure we can fix that for you. Of course, sincerely appreciate everyone's time today, and really looking forward to delving into our no problem, man, no worries. Delving into our 10-year strategy together. I've had the distinct privilege as a director coming in the fall of 2022 to be at the heart of this new strategy process, which has been wonderful, engaging with so many hundreds of RHSC's members, and also, in addition to the strategy, putting together our new 4-year program of action, the first part of the strategy. More on that a bit later in the webinar, but exciting to have those two keynote inflection points, if you like, happening at the same time. So we'll move on to the next slide. Thank you so much. So what's new? Well, the strategy 2035 really does make some significant updates and some substantive adjustments. And key among these are this emphasis on equitable access. So the elevation of equity from its prior position as one of the 4 strategic objectives within our previous strategy to now this superseding or this central position within our re-articulated vision and mission statements in the updated strategy. And of course, equitable access means that all people around the world can obtain and use their preferred RH supplies, regardless of financial means, age, sex, race, ethnicity, national origin, education, range of ability, sexual orientation, gender identity, political perspective, or geographic location. And our vision depicts a future that is shared, I think, by all of us within the RHSC and beyond, that all people have equitable access to a broad range of safe, effective, and affordable supplies needed to meet their SRH needs. Now, our mission, of course, really does focus in on how that vision will be achieved. And in terms of that, RHSC increases equitable access to a full range of safe, effective, and affordable supplies that meet the sexual and reproductive health needs and desires of individuals living in low resource settings by harnessing the coalition's unique combination of expertise, ingenuity, and the collective action, that key collective action of all of its members and partners. So some key new areas and new focus points within our strategy. And we'll move on again. And I'll talk about affordability. Now, affordability is a new strategic objective, which together with availability, quality, and choice really do anchor our new strategy. Affordability is very much on the basis of RHSC's previous work in this area, from promoting innovative financing options to supporting volume guarantees work and much more besides. So within this, we will be promoting coordinated action on financing for RH supplies, procurement among global players, among procurers, among countries and governments, of course. We'll also be working hard on aiming to ensure that all people have increased access to their preferred product unimpeded by any cost barriers. And those two pathways are very much at the heart of this new affordability strategic objective. Availability, choice, and quality remain very central to RHSC's work, as they have been over the last 10 years. And so within availability, key pathways around making supply chains resilient to safeguard access to those RH supplies by leveraging data, technology, and human resources. That's a first pathway under availability. And a second is to facilitate more reliable access to the full range of existing RH products. Now, quality, of course, absolutely central again to all of our collective work, really does focus in on ensuring that people can obtain safe and effective RH supplies, of course, with some key pathways work around improving the regulatory environment for those high quality supplies, as well as ensuring that people are able to trust in the quality of the RH products they buy or use. And then the element, the strategic objective of choice. And for us within the coalition, choice focuses on more coordinated investment in new product research, product development pipelines, and improved coordination around new product procurement, introduction, and scale up. And that very much distinguishes the choice strategic objective from that on availability. And we'll move on again to the next slide. I'm moving at a brisk pace. We want lots of good time for Q&A, as well as hearing from Claudette, Martine, and Tanya a bit later. So transformational leadership, Beth mentioned this in her opening remarks. And so we really have made this a central facet of our new strategy. We're expanding our membership. We're at 560 members and counting. We have greater regional and country level representation than ever before. And they've really led to a much deeper and more intentional approach to fully engage our members, transformational leadership. We've talked in our previous 10 years of our strategy. We've alternated in many ways from talking about leading from behind, that platform, that collective action, that neutrality, that convening space that RHSC provides. And then we've talked about leading from the fore when we've led on key global goods such as the LEAP report and the Visibility and Analytics Network, for example. And so that sort of leading from behind, leading from the fore has really coalesced into our adopting this transformational leadership to more clearly set out the pathway forwards. And we really feel that this is a sector-changing, sector-galvanizing approach to really get member participation throughout the coalition and makes explicit several facets here. And you can see bold, facilitative, adaptive, power sharing, of course, very important, self-reflective on our work, accountable and visionary as key facets of this work. And all of this came out as a result of a really robust set of conversations within the executive committee that Beth chairs, within the strategy advisory group, to really set out the unique nature of RHSC's leadership model. And we really will focus in on ways to work with individuals and organizations across those diverse sectors and settings to really advance our shared agenda through collective action. And as Beth said very clearly at the beginning, as a membership organization, our approach is really centered on the needs and priorities of our members. And so we'll move to the next slide. Thank you so much. So for each strategic objective, we identify clear outcomes that really crystallize what the RHSC and its members engaging with one another expect to deliver in 10 years' time. And the outcomes that emerged out of the strategy process have been set out very clearly in the document. They capture our contributions as a coalition to the most important change areas that we can really focus on and address collectively during the next decade. And these change areas emerged out of that landscape review and those key informant interviews that Veronique reminded us about just a moment ago. So they include, of course, transforming markets through improved data visibility and use, mobilizing global and domestic funds for RH supplies, bolstering manufacturing capacity, particularly in low resource settings, helping to work on driving price reductions in RH supplies, increasing the supply and demand for safe and effective products, advancing country and regional ownership of supply chains, and very importantly, championing gender equality. And these outcomes really show this community's recognition that no single institution or sector can ever meet these supply challenges alone. And they also really truly reflect our community's conviction of the importance and utility of a global coalition with 20 years of experience. RHSC came into existence in 2004, of course, and we continue to cultivate these transformational partnerships in the service of our common vision, of course. So we'll move on, and just a couple more slides, and then I'm really excited to talk a little bit more with other colleagues on the line. What stays the same? Well, RHSC's levers of change that you can see here, the 6 levers of change are unchanged from the previous strategy. And these are very familiar to us, of course. They support the strategic objectives that are central to achieving our vision and mission. They really do define the attributes that RHSC as a coalition can really bring to bear to produce those important results. And so the strategic objectives and the levers of change together yield a strategy that's really comprehensive, but also within our manageable interest and has been time tested over the last 20 years. So of course, our neutrality, our convening power, our brains trust the collective wisdom that is within the several thousand individual members of the coalition, the way that we can broker partnerships, particularly given the diversity of our membership, that important public-private sector, governments, implementing partners all coming together. The flexible resource base that we have allows us to pursue necessary activities that may fall outside of the remit of a single entity or donor. Some great examples within the last 10 years of that flexible resource base and our ability to move swiftly, collectively, with the coalition's resources on response to COVID, for example, whether that's work within the Visibility and Analytics Network to try and reduce stockouts, whether that is the series of Compass reports that we produced to show the important ways in which supply chains were adapting and needed to adapt in the future. And of course, our respected name, that 20 years, the brand, the track record of success, and the member commitment that comes with all of this. So we'll move on to my penultimate slide. So guiding principles are largely intact as well. It's important, I think, to highlight here, though, that we really do prioritize our work to advance gender equality. This fifth point that has been added to our guiding principles, we really do focus in very much on RHSC as a gender transformative organization. Through our work, of course, we make sure that we support the entry of ever more women into supply chain roles, and we'll talk a bit more, I hope, in the Q&A about this in terms of the continued power and the continued impact of our laptop work, our scholarships for young supply chain professionals. And the 6th element here I just wanted to highlight as new, and this is a new guiding principle, but the importance of trust that has the power to drive that collective action, the trust that our members have in RHSC, in your coalition, and its neutrality. That trust is facilitated by sharing information, articulating mutual goals, and applying our levers of change. This trust and working together was evident only just a few days ago, for example, when I was delighted to be working with some 40 or 50 of our manufacturer members of the coalition in Copenhagen as we brought together issues of shared interest and concern and problem solve them in a neutral space that could never happen otherwise. So guiding principles largely the same. So my last slide is just about the strategy map here. So I do hope you like the sort of look and feel, the graphics within our strategy document. We're very, very lucky here within the Secretariat of the Coalition to have some hugely skilled people working in our communications team, Hannah and Lucien, Veronique and others who've really brought this document to life. And this strategy map really then links our strategic objectives at the top: availability, affordability, quality, and choice, with those key pathways that really define the unique ways in which RHSC will work. We're not boiling the ocean. We're not duplicating things that others are doing. We are very clear about where our added value is. And then within that, we have an indicative set of activities that will show how we will work in these pathways within this strategy map. Of course, all of this then will link to a very clear results framework and measurement framework that will be in each of these 4-year programs of action as we've been describing. So lastly, to say that our hope really is that our members, our members, do see yourselves in this strategy and clearly understand how you can take it forward. As Beth articulated earlier on, our hope is that this document and the clear way that it's laid out makes it even easier for our members to decide what they can commit to and where they really see themselves in contributing to our shared vision and mission in the next decade. And we really do look forward to engaging with you all on this work. You will see this within our implementing mechanisms, our working groups, our caucuses, our forums. You will see this in an interactive session that we will have on our 4-year program of action in the first quarter of next year. And if you're wondering about any of this and you're wondering where can I fit in, how can I as a member fit into this new strategy, my door is always open. My physical door is always open. My calendar is open to speak to each and every one of you as members and to think through how we can work closely together in the service of this 10-year strategy. So I'm just going to pass back to Veronique for a couple of further key points, and then really looking forward to getting into some of the presentations from Claudette, from Martine, and from Tanya. Back to you, Veronique.
Thank you, Martin. Next slide, please. So we've created an online hub that serves as a repository for everything that relates to our strategy. This hub's provided at-a-glance information on what's new and what stays the same. It also offers some resources for you, an introductory video, the strategy document itself, and a summary of that strategy as fact sheets in different languages, so in English and Spanish and French and Mandarin. It also includes a media kit, and soon it will house, of course, the recording of this webinar. And as Martin has mentioned, you will also see on this hub the link, the registration link to an upcoming program of action launch meeting. And this will be a series of meetings that we'll start hosting in Q1 of 2025. Next slides, please. Next slide. So this strategy is ambitious. We're very aware of it, but we are starting now to put it into action. RHSC embarks on this on this strategy within the context of a new program of action that coincides with 4-year funding cycles that is set to launch in January. The 4-year program of action comprises some metrics that map to the outcomes that are described in the strategy. And the program of action itself really serves as the operationalization, the implementation of our strategy. So how can we bring this strategy to life? Well, first, you can become part of our interactive virtual events to launch our new program of action. In the first quarter of 2025, we'll host the first in a series of meetings that will invite members to find their place in this program of action. This virtual meeting will offer an introduction to the priority areas that are described in the program of action and offer also some breakout rooms for participants to dive deeper in some of these areas. So look for an invitation to participate in this launch meeting early in 2025. In the meantime, you can also take some time to explore the resources on our website, on the resource hub for the strategy, as well as familiarize yourself with the document. And third, we really want to encourage you and invite you to participate and to engage in our working group, in our caucuses, in our regional forum, in our work streams, really to identify opportunities for joint actions, including outcomes that align with the outcomes that are described in this document, and help advance towards those outcomes. Of course, this is a strategy for 10 years, and we can't predict everything in the ecosystem, certainly not 10 years ahead. But really, the working group offers a unique space where members can work together to identify new opportunities for joint action that respond to emerging issues in this landscape. So I think I will, next slide, please. I will hand it over back to you, Martin.
Thanks, Veronique. Please do get those questions in the chat. We had plenty, actually. We invited you to submit your questions as part of the initial registration for this webinar. So we've got a lot of great questions to get us started in the Q&A, but really want to add to that with a few more that I'm sure are on the tips of tongues out there. So, but let's really move into the heart of our webinar, quite frankly. Now, our strategy does lay out through the vision, through the 4 strategic objectives, what our community cares most about. And over the past year, and that sort of late 2022 through to the middle of 2024, so many individuals contributed their time, ideas, and perspectives towards developing strategy 2535, and those insights and reflections, of course, fundamentally shaped the formulation of this 10-year strategy. So today we're really excited. We're really honored to have with us a few of those great RHSC champions who were part of that advisory group that provided such important input and guidance on that process, and really looking forward to sharing their thoughts today on where they see their particular country, region, working group set of important RH supplies issues in the context of this strategy. So first of all, I'm really excited to introduce Dr. Claudette Diogo. Claudette is the logistics and supply chain professional responsible for reproductive health commodities, and currently is acting as a National Family Planning Program Manager at the Ghana Health Service. Pharmacist by profession, Claudette holds a master's degree in international healthcare management, economics and policy, and a master's of science degree in supply chain management, of course. Now, she's had over a decade of experience working with the Ghana Health Service and is currently, and we're very, very proud of this, an RHSC VAN ambassador, as well as the first ever country representative on the VAN steering committee, and is very much in a driving seat of shaping RHSC's work in many ways. And so no one really better to get us started. I'm going to hand over to Claudette, and maybe we'll take the slide off the screen for a moment and get your video up, Claudette. But we're really wanting to hear from you on this strategy, how it resonates with you in the Ghana context, and how you see it in terms of the very important members who are working in country can work with this strategy and putting it into action. So over to you, Claudette.
Thank you very much, Martin. And thank you so much for the opportunity to share what we have to do from Ghana. As much as possible, one may ask, what does the reproductive health community actually care about most? The new strategy actually lays out through its vision and its 4 strategic objectives: availability, affordability, quality, and choice, like Martin and Veronique has actually gone through with us. And these 4 objectives, especially availability, which focuses on ensuring that a full range of reproductive health supplies is widely and readily available throughout the market, from manufacturer to the point of access provision, certainly reflect the priorities the VAN community, or the visibility analytic work community, which Ghana has been part of since its early beginnings. Ghana's government actually is committed to reducing inequalities in access to reproductive health care, and has been it for a number of years through its digital transformation journey. For those of you who are not actually familiar with the Global Family Planning Visibility Analytic Network, I'm pleased to let you know that it actually has about 130 member organizations, including 36 country governments, to actually track about 10,000 shipments of about 83 products, and across 159 countries. And as much as possible, this actually gives us some real-time information, and it actually empowers us to actually have reliable data where we are able to actually make decisions to ensure that stocks are available. And as much as possible, brand members actually work together to arrange product transfers, drive new procurement, and rush deliveries when needed. As much as possible for Ghana, we've been able to actually avert some stockouts because of the VAT. And this is actually a very joyous thing to share with the platform, to know that, yes, course, Reproductive Health Supply Coalition cares because with the van, we are able to actually avoid any form of overstock that could also lead to expiries or some form of wastage. Yes, and when I actually consider the whole strategic pathways and the availability, I see these pathways and outcomes map reflections when fund members, including country governments and their partners, care most about to make supply plans more resilient to actually safeguard reproductive health for all by increasing data visibility so that country governments, procurers, social marketers, organization, manufacturers, and shipments working together can make affordable and informed decisions and act to address the barriers actually that hinder the flow of family planning products into the hands of women who actually need it at that time when they actually need it. And I would say that country level advocacy has actually been very good because of the van, because actually as we speak, it actually offers for us funding gap analysis where we can use for advocacy and be able to get government to actually commit more because in the past, there is nothing like that. They are not able to share or see what they need to commit. And it has actually helped us to be able to also achieve what our FP 2030 commitments are. As much as possible, such contributions have actually oriented towards country level and regional level decision making and ownership of the reproductive health supplies financing. Yes, it's been a very wonderful time, and we think that the resilience that the strategy actually echoes is something that we actually obtained from the last GMM that was actually conducted or actually held in Ghana, because that resonates a lot, especially after what happened in 2020 in terms of the COVID. We actually learned that we need a lot of this, especially with the van that shows visibility across all stakeholders to be able to come out to make sure that affordability for our productive health commodities are what is available. And then at the end of the day, we will have products available and the family planning service or productive services accessible to all who need it when they need it at the right time. Thank you, and over.
Thanks so much, Claudette. Great to hear that it resonates well in the Ghana context. Lots of change coming in Ghana potentially in the coming weeks and months, which we'll be keeping an eye on and continuing to work with the Ghana Health Service with yourself very closely. Great to hear that the funding gap analysis, the stock transfers, all of that key, very practical work, the connectivity of the GILMIS, of the Electronic Logistics Management Information System, with the van for greater data visibility, all of which works and resonates very well in the Ghana context. And Ghana within the ECOWAS region, of course, set of countries that really is driving forwards on a whole set of issues, including joint supply planning and much else besides. So Claudette, thanks a million for sharing those views. And I'll turn next to Martín Gutiérrez. Really looking forward to hearing your views, Martín, on how you see the priorities and experience of our members across the Latin America and Caribbean region, how that's reflected in this new strategy, and really to understand this in a critically important region where crucial inequities persist and continue to really challenge access to RH supplies. And just a quick intro to Martín for those who know him. I'm sure we all know him well, but he's the Associate Director of Partnerships and Development at False Feminista, which is an international alliance for sexual and reproductive health, rights and justice. And he's a member of the Executive Committee of RHSC, and he's also the board chair of the Latin American Forum FORELAC. So Martín, over to you. Thank you so much for your time today.
Thank you very much, Martin. Good morning, good afternoon to all of you. I would like to express my gratitude not only for this invitation, but also for the opportunity to highlight some of the great elements that conclude in this amazing document. I'm quite sure if you have the opportunity to review it and check it, you'll see that it's a lot of work put it there together, love, time and effort towards an amazing document that shows not only the possibility to work together throughout different regions, but also the opportunity to see a truly valuable document to understand how we can highlight 4 main strategic objectives. And this is not only about communication, because I love to highlight how amazingly beautiful is the document, and you will read it and see it, and all the visual identity is quite amazing. But I think just highlighting availability, affordability, quality of choice as the 4 objectives that we've been talking, I think discussing a little bit more about equitable access takes a superseding position within the RHSC new strategy, and re-articulate the vision and mission statements. Expanding equitable access to high-quality reproductive health supplies and improving SRH outcomes for marginalized populations. Sorry, I'm a little bit congested here. Included youth, people with disabilities, indigenous population, Russian and ethnic minorities, and persons living with extreme poverty, among others, is a priority for Latin America and the Caribbean, thinking about how important it is to address these strategic objectives throughout an intersectional lens. So I think it's important to understand and try to understand also how difficult it is to manage and plan something with this difficult context that we are facing. In this terrible context where rights and reproductive justice is in the stake, I think having the opportunity to create real elements to address real access to contraceptive access and products is quite important to see how we can work together to make this happen. While most countries in the LAC region have seen improved coverage of reproductive health services in the last decade, significant inequalities persist both between and within them. And addressing these inequities is fundamental to achieving universal health, protecting human rights, promoting gender equality, combating discrimination, and improving reproductive health outcomes for groups who have been marginalized by health systems far too long. And I think I mentioned this context just thinking about that there are countries in our region, in Latin American region, that have decided to basically dismantle the sexual and reproductive health services and work. So how we can ensure that women, girls, and gender diverse population have real access is one of the main challenges that we have to face. Thinking outside the box, thinking as a movement where commitment with responsibility and different ways to address these main problems. Also, as you know, as you probably read this, Latin America and the Caribbean is one of the regions that is the most expensive way to get contraceptive access because it's a 60% out-of-pocket expense. Even though we have access throughout public services, and now this is changing, people remain getting these products throughout out-of-pocket money. So how we can address main issues as youth pregnancies and also abortion access. And I think obviously COVID has struck us really, really hard. We went back almost 30 years thinking about access, thinking about services, and thinking about not only the important topics that we have to discuss. I think it's quite important to understand that the public provision is at stake in this moment, and the movement, especially organizations like RHSC, is going to be crucial in this aspect. RHSC focus on affordability and on removing cost barriers that hinder availability, effective use and choices, therefore very relevant. It is very much reflects the priorities of FOROLAC members and partners who are working to remove cost barriers and many people face, especially given the out-of-pocket expending of contraceptive in the region. As I mentioned, it's about 60%. In FOROLAC, we work together closely with governments, the social civility organizations, but I think it's important to understand that we have to think ahead, how we can cross those barriers and think about how, in the most crucial moments, we have to get together. And I think data information is quite substantial for these elements. You will read throughout the document that Forolac data platforms tools, including CEPREMI, BIPLAN, SCOD, and others, have a potentially meaningful opportunities for research and also for decision-making process. It's also keeping LAC governments and their partners focused on commodity security by helping them maximize every dollar and quantify the health impact on their investments. But at the end, it's not only about money, it's not only about numbers, it's about women and girls. Forolac will continue to focus on generating new business intelligence and market analysis to support decision-making among public sectors and officials in the region, and spoke clearly about the barriers that we are going to face in the near future. Forolac will also continue to promote an adoption of diversified financial approaches, such as Chile's Senabast public-private program, to lower out-of-pocket expenditures for those who access reproductive health products in the private sector. Finally, I would like to highlight how important it is that the chair of the RHSC, Martin's leadership throughout this process, helped to get together many people, not only about the voices, ideas, but to truly create opportunities to show feedback, to express our ideas, and to get together all the voices of the membership that we are working. We are really grateful for this opportunity. LAC region feels, and I don't want to put myself in one voice, but definitely understand how important it is to create different bridges to make this available for all. Thank you, Martin. We'll get back to you.
Thanks so much, Martin. Muchísimas gracias. Thanks for the leadership within Forolac, for the deep engagement that we have with several hundred partners on the continent. And, you know, our work continues, but very excited indeed that the International Conference on Family Planning is going to be in Bogota, Colombia, in under a year now. And excited to see the RHSC membership in full force there, as well as a very substantial set of our key Forolac members highlighting the great innovation that exists on that continent for sure. Thanks, Martin. And so last but by no means least, Tanya Mahajan. Now, Tanya leads, and Tanya, you're now at Menstrual Health Action for Impact, aren't you, having previously been at the PAD project. You're all about leveraging market-based approaches for increased access to RH supplies, specifically to menstrual health products, and all of this work very much at the heart of all that RHSC holds dear. We're really, you know, so pleased to see the way in which you drive evidence-based advocacy on informed choice and quality, that key data that drives that, of course, that we speak about. And so we're really excited, Tanya, to hear from you a little bit about how you see the priorities of the menstrual health supplies community, how they align and link with RHSC's new strategy, and how it may offer your members a sort of menu of the way that they can engage to expand access to choice of high quality, affordable menstrual health products. So Tanya, great to have you with us. Thanks for your work with the menstrual health supplies work stream, and over to you.
Thank you, Martin. Thank you for that warm welcome. And I think just at the very outset, I just want to acknowledge and appreciate RHSC's efforts in elevating menstrual health, because I think back in 2019, when the work was just starting and the work stream was very nascent, and that was the first time I engaged with RHSC on this topic. This was probably the only platform where we could actually talk about the supply lens and the market lens to menstrual health. So you know, just very thankful and grateful for that, because that's really advanced the work that the sector has done overall. And also really grateful that you have, you know, used the input that the workstream members have provided and given us the opportunity to sort of put those priorities out there. And so just taking from that, I was really, you know, we worked on the work plan for the workstream, an indicative one in 2023. And I was very excited to see equitable access at the very top within the strategy, because I'll just read a line from the work plan that we had developed. which identified the overarching goal, which is equitable access to a basket of quality menstrual health supplies requires a dedicated supply lens. And the RHSC menstrual health supplies workstream, therefore, will focus our attention on the supply chain aspects of menstrual health with the goal to increase, expand, and improve access to a wide range of high quality, affordable menstrual health products. So you can just see, how overlapping the objective we had set out for the work stream is to the vision that these strategies sort of outlines. So equitable access is definitely something that is high on the work stream's priority list. And we actually see choice as a very important pathway towards achieving this equity. In fact, one of the key activities that RHSC does, which is the LEAP data, has actually shown us how access is still quite inequitable wherever it has improved, but that choice can actually be a pathway for increasing that access. There's a lot of partial use across various low and middle income countries, and there is use of reusable products, which creates market potential for increasing equitable access through offering a wider variety of menstrual health products. And so market development for a basket of products is something that is definitely high on the list of priorities for the work stream. In fact, we've been working to develop a theory of change for market-based approaches to menstrual health. And again, choice is very much a part of that. Secondly, looking at affordability and availability together, again, I think for the work stream as such, and also highlighted in the work plan, addressing cost barriers and supply chain resilience are both high on the priority list. Affordability is a concern across many geographies. In fact, again, another activity that the RHSC supported, which was a landscaping study on understanding supply side factors, brought out the disparities in pricing and gave us some very solid quantitative and qualitative evidence on understanding the market better and understanding some of those affordability and availability constraints. So the workstream does want to focus again on building on this evidence, building on the understanding of the barriers to affordability, looking at taxation structures across the value chain, looking at how harmonized HS codes by the World Customs Organization plays a role in addressing affordability. So understanding and sort of taking a deeper dive into all of these factors that can make menstrual health products more affordable. Within availability, again, we really, like I said, and also Martin, you highlighted, COVID sort of threw a curveball at all of us, and RHSC also acknowledged the supply chain shocks that even menstrual health products faced during that time. So supply chain resilience is again another top priority for us, and looking at models of delivery and integration of menstrual health products and services with other reproductive health areas is something that we see as a pathway for increasing sort of resilient supply chains, because menstrual health has always worked in a silo, but we now want to see more integrated delivery of products and services. Last but definitely not the least is quality. Quality is something that's a lot of workstream members are working very closely on. And the strategy identifies both improving the regulatory environment and increasing recognition of safe and effective products. And I think many members are working on both these aspects. So the first one, many members are engaged with the ISO process for development of menstrual health product standards, and also engaging locally with their national standards bodies. And also in terms of increasing recognition of this process and the importance of standards, we do want to prioritize advocacy with national standards bodies, with governments across different countries, with development sector partners working in these countries. In fact, we planned a webinar with the African Coalition for MHM in early 2025 to really talk about this further, and we hope that a lot of you can join to learn more about that work. So overall, I would say that I think for the strategy, the work stream really sees a lot of technical alignment, and we really look forward to sort of reviewing our priorities to align more structurally as well, and working with the other IMs, as whatever the structure really comes out to be, working with the other IMs, including advocacy and accountability, including the market development working group, to really see how we can take this work forward. Thank you.
Thanks so much, Tanya. As someone who was, again, very lucky to be at an RHSC general membership meeting, I think in Kathmandu, if I'm not mistaken, back in 2019, to see how far this crucially important work on menstrual health supplies has come in those 5.5 years is remarkable, absolutely appropriate. That work stream and this work overall is very central to our new strategy. You know, and the standards work is crucially important. I attended several menstrual health meetings at the UN General Assembly in end of September, and this standards work comes up time and again alongside these elements of taxation and cost and so forth is absolutely crucial that we need to work on as a community. So glad that it resonates with you with the work stream, Tanya. Really excited for the work that lies ahead. So we've got now, and thank you so much to Claudette, to Martine, and to Tanya, who I hope are going to stay with us. It's quite late at night in India, Tanya, 9 p.m. I think, or thereabouts. So we do really appreciate it. We're going to move now on to the next slide and into, I'll just thank a couple of people and then we're going to move into our Q&A section. So our three speakers really do exemplify all of those within our strategy advisory group and our wider set of members and partners who contributed to our strategy. I'd like to thank them, to thank our strategy advisory group, who are too numerous for me to mention, for Veronique and I to mention on this call, and also to thank RHSC's executive committee, Frank van der Lee, our chair, who started this process, and Beth, who came in and very much helped us to complete this very, very consultative strategy process. Very grateful to everyone, and it will be best shown in terms of the success of that strategy. Yes, in a great document. Yes, in a great conversation, but absolutely being very practical people as RHSC members in the way that it is implemented. So we'll move into a Q&A now. And as I say, we had lots of great questions that were submitted as you were registering for this webinar, which I'm delighted to bring forward now. I had a couple more also added in the chat from Sarah, from Mercedes. I really would like to see a couple. We probably have a time for a couple of other questions as well. If you put those into the chat, whatever's top of mind for you, please go ahead and do that now. But I'm going to start off with a couple of questions that came in from people as they registered, were very much on your mind as you saw the strategy document when it was published and as you signed up for this webinar. And I'm going to enlist a bit of help from Beth, from Veronique, Claudette, Tanya, Martine. I may well come over to you as well as we go through this. But first question, and it's a very good one, very topical. And I might actually ask this of you, Beth, if that's okay. How does RHSC see the results of the US elections, and how does it affect this RHSC 10-year strategy? Over to you, Beth. And Beth, you're on mute, I think.
Do that. Okay, so thanks for giving me a tough question first. I don't know that there's a ready answer for that question, but it's a good one. And I think that we need to put the United States into context with other donor countries and the shifts in foreign aid that we're seeing across the board and across the board politically with the leadership of several countries, many countries. We have been through a period like this before with RHSC, and in some ways, I do feel like we're going back to the early days of RHSC when it felt like at least the United States government wasn't paying as much attention as it should be to the kinds of things that RHSC in the beginning was thinking were important. Just basic access to contraceptive supplies. It was that simple, and it was just something that was never a priority. We're much more powerful as a coalition now than we were then. I mean, we were pretty good then, but now we have more diversity. We have a lot more issues at hand, and a lot more entry points for advocacy and accountability, for working with governments that do still want to see the health of their people as a priority. So I think that there is often a lot more creativity and a lot more common cause when we're in a period of adversity. And that's coming from a long history for me of working in this sector. And I have seen it several times this is the time when we get a little more ambitious and a little more creative.
Thanks so much, Beth. Really appreciate that answer. So next question, Veronique, I'll put this to you if that's okay. Why do we need to stretch the strategies period to 10 years instead of focusing just towards the short term and 2030 and attaining the SDG goals and targets? Over to you, Veronique.
It's a great question, and it's a question that we grappled with when we started this entire process in 2023, or even before that. We went back and forth with our advisory board, so the executive, on that questions. And at the end, we landed at 10 years. The strategy document is aspirational. We're very aware that 10 years is a long time away. But in terms, we see those 10 years as being the way we've implementing it is in phases, in those incremental phases. The first phase is the one that we've described as our program of action, which will end really at the very end of 2028. I think the strategy, the way it's laid out, and that's our hope, really leaves a lot of room for new opportunities, new issues to emerge, and new opportunities to respond to those issues. We will work very closely, and we work very closely with our members, with our working groups, as well as with their executive and partners, really to look at these changes in the landscape and to change course if that is needed. So we very much see this strategy as aspirational, program of action, more on the implementation, on the operationalization, I can't say that word, operationalization side, but really thinking of the strategy as being implemented into phases with the opportunity to adjust course as needed in coordination with our members and partners.
Thanks, Veronique. I trip up on operationalization all the time. I probably get it right 1 in 5. So thanks for that. Thanks for the great question. Appreciate it. I'm just going to take one of the questions from the chat now. And Sarah, Mercedes, if you'll allow me, I'm going to put those 2 questions somewhat together. I'll just summarize those questions. Sarah said, "Great to see the revised strategy come to fruition. I look forward to supporting us collectively achieve the outcomes. During the strategy development process, there were consultations with the different implementing mechanisms, caucuses and work streams about the structure of these groups with RHSC. Can you clarify what, if anything, structurally might be changing, and if so, and when?" And Mercedes, thank you so much. "Could you share a bit more on the 4-year program of action? I'm particularly interested on how the implementation of that program of action is envisioned in light of the ongoing discussions about the implementing mechanisms, the work streams, the caucuses of RHSC." So I'll answer those 2 questions. And Kristin, I see your hand is up. Kristin, could I ask you to type your question in the chat, if possible? That would be great, and I can then sequence it with 1 or 2 of the other questions that we're going to take. Thank you so much, Kristin. So Sarah, Mercedes, well, the huge amount of feedback that we received, as you're highlighting there in your question, Sarah, from our members during the strategy process has already really informed elements of the structure that we definitely need to retain and cherish, and has given us, I think, now a clear direction on areas that we can also really improve. A lot of this is about sequencing, quite frankly. Of course, we wanted to get the new strategy in place to get some of the fundamentals around the 4-year program of action, to ensure that the funding was in place to support all of this as well. So now we're really in a sequencing phase, and I hope this gets to the heart of your question. So we're now going to evolve the IMs to align with the new strategy, really aiming to enhance coordination, prevent duplication, and advance efforts across our pathways. I'm really, privileged to be working with our colleague Ntinde Luembe, who leads all of our work on our implementing mechanisms, and she is leading a process with the Council of Chairs. Those are the chairs of all of our implementing mechanisms, the work streams, working groups, caucuses, and forums, and that process should be concluded by mid-2025. It will continue to be highly consultative with the Council of Chairs, and then by extension with those working groups. It will all be done in lockstep with our members. But I hope that answers your question, Sarah Mercedes. Please feel free to put in any follow-up in the chat, and I'll get back to that in just a moment. We're going to move on a little bit, and let's Veronique, if I can come to you. We've had a couple of further questions from our registrants. Could you talk a bit about how youth inclusion will be considered in this strategy, and the upcoming general membership meeting, how that will work, how RHSC sees youth engagement?
Yeah, thanks. Great question. And I know this also came up during the GMM last year in Accra, Ghana. So we've learned really, I think, over the years that our comparative advantage in the youth space really lies within the broadest set of concerns that drive young people's interest. And those interests that we focus on is really their education and careers, advancing in their careers in the supply chain. Martin mentioned earlier in his presentation, RHSC hosts a laptop initiative, which seeks, among other things, to encourage the entry of young people, and women in particular, into what remains a field that's dominated by males. And when you look at our strategy and our strategic objective of availability, it does have an outcome in there in terms of our commitment to ensuring that young supply chain managers have increased access to educational opportunities that raise their profiles and their skill base. RHSC also will continue to host what we've been hosting during the GMM over the years, program called the Supplies Fellows, that matches or that nurtures the next generation of professionals in reproductive health by matching them with other members of the RHSC that have been in this field for more years. So this will continue as well, and we'll continue to also engage, work with our Council of Chairs, the chairs of our internal structures, so working groups and caucuses and work streams, to include really the voices of youth focus groups within the discussions, whether it's across the therapeutic areas or the thematic areas of those working groups.
Thanks so much, Veronique. I'll move on to another question, which I'm actually going to answer. That's okay. So thanks for the new strategy, RHSC. I'd like to learn how the strategy has integrated gender transformative approaches and programming. So great question. Gender equality, a principle of the strategy, as I laid out earlier on. So equitable access, of course, at the center of all we do. And that equitable access ensures that women have ever more options and greater possibilities to actualize their rights and preferences in a crucial area that in turn impacts so many other areas of their lives. And so we see equitable access as a critical pathway to advancing gender equality and equitable health outcomes that benefit all. And that commitment and that recognition that at our core, RHSC is a gender transformative organization really does guide this strategy and guide our upcoming 4-year program of action. And so gender transformative investments, as you all know very well, are designed to reduce gender gaps and gender-related barriers in agency or control over resources. And so from the very start, RHSC's been dedicated to developing mechanisms that really effectively and collectively channel RH supplies investments with the aim of putting quality, affordable RH supplies in reach for women and girls and facilitating true reproductive choice and agency. We are a technical organization, coalition focused on supplies, of course, and so our approach to gender transformation is through that supplies lens. And a key example that I mentioned earlier on is through our laptop work in supporting the professional development of female supply chain managers. And this work really holds great potential and has already begun, of course, to make significant changes in what has been quite a traditionally male-dominated profession for many decades now. And we're working towards rendering supply chains that are increasingly sensitive to women and girls' health needs. We had that key session at the general membership meeting in Accra last October about this very issue. Now, 65% of those laptop scholarships have gone to women. We've sponsored a pioneering supply chain internship program for young women in Kenya with a more than 70% full employment rate for those young interns. And we've gathered leading women in supply chain to speak to eradicating those obstacles to the employment of female supply chain managers. And we will continue this, and it is a central part of our new strategy. So a quick fire sequence of questions. I've just got a few more, and I'm still again looking in the chat here. We all have to be very adept at multitasking, don't we? In looking at the chat, looking at the time, looking at our notes, making sure we're unmuted, etc. So I just wanted to come back to you, Tanya, and just a little bit more reflection. And this is an answer, perhaps answering one of these further questions that was recently submitted. Why now for menstrual health products within the strategy? What's changed? Why is the time right for menstrual health supplies to be even more prominent in RHSC strategy than it was 10 years ago or even 5 years ago in Kathmandu? Over to you, Tanya.
Thank you. And thank you for the question. That's an excellent question. I think that the menstrual health space has evolved in a way where our understanding of what works and what doesn't work has also really evolved. So where it started from the wash sector, it was primarily, free distribution of products. It was primarily looking at just addressing unmet need and access with providing products, whatever way it happens. There was not really a structural understanding of what are the barriers to the market, where is affordability, availability, choice, quality constrained, and how are those working as part of a systemic landscape, and not just to say that a person doesn't have product in their hands when they need them. As our understanding has evolved, and as RHSC has also taken up this initiative and taken up menstrual health more and more in building the evidence and in helping us understand the market side of things better, I think the sector is also recognizing that menstrual health is much more than just product distribution. It is looking at the structural barriers to the market. It is looking at understanding the fact that if the unmet need, we have whatever billions, 1.72 billion menstruators worldwide, access is not just limited because nobody is giving product to them. It is because product is not available in the marketplace. It's not affordable, that we don't have standards. So that understanding has evolved, and there are now funders, donors, governments, development partners, a variety of stakeholders who are acknowledging these factors. And so I think it's more important now that RHSC continues to push this lens, the supply lens, the market lens on menstrual health, and sort of use the democracy of the markets to help take our menstrual health outcome agenda forward.
Thank you so much, Tanya. Great answer. So Three quick questions left, if you'll allow me, and I think we're still good on time. So, Veronique, I'm going to put this over to you. So, great to see affordability as a strategic objective for RHSC. Was commodity cost effectiveness considered as a key element here as we put the new RHSC strategy together?
Well, affordability really is what resonated with our members, with the advisory group, when we started those consultation back in 2023. It's, as you've heard in this document, most of our members, and even the vision of equitable access, is what resonated with them the most. They felt that from the perspective of users, or the perspective of users, is what matters the most. If a person can access the products that he or she wants. It's not to say that cost effectiveness is not in our mind. It's just not the main driver. Cost effectiveness and analysis is helpful in terms of deciding whether and how to allocate the limited resources efficiently by identifying an intervention that provide the most health benefits per dollar spent. And this may be particularly relevant for maternal health that tend to be more provider reliant. But the concern from our members is also that cost effectiveness can potentially neglect equity issues and not always consider the full impact and the societal impact of making a product available. So again, I think this was more in response to our members' desired to put affordability as a strategic objective.
Thanks so much, Veronique. Now I've got I said there were 3 questions left. There's one last one as well. So I've got a quick question for Martine, one for Claudette, and then one that I'll answer to finish, everyone, if that's okay. So Martine, you were very eloquent in terms of the success of Foralac. What's replicable in your opinion in terms of how successful Foralac has been with the coalition that other regions might take forward, given the challenges they're grappling with, that the LAC region may have seen, whether that's a reduction in donor funding, whether that has been maybe some political pushback in some geographies. What can you impart to colleagues in other regions that's replicable from the Foralac success?
Sure. Thank you, Martin. I think we are really, really proud about the work of Foralac, but I think this is something that should be put in context, just because, you know, we are an organization with more than 10 years. So obviously that gave us a huge realm of opportunities, not only about lessons learned, but also how we've been trying to shape Foralac. I think I would like to highlight 3 main elements. The first one is how the movement get together. I know it's difficult, it's challenging because of the different expectations, challenges, and needs, but I think Foralac had the opportunity to have a really unite governing body and also a really good advisor throughout the process. That's Milka Dinev and Ximena Bernardis now. So I think that joint structure helped us to move together, not only the public sector approach, but also the CSOs and the multilaterals and governments. And I think having that quite challenging space to hear from all of us, from all of them throughout this whole many years, help us to have a structure that hears and also understand how to respond to the membership need and requirement. Obviously, we have a lot of room to improvement, but I think it's important. The second one is the business model approach. I think we've been able to gather some business intelligence tools, as I mentioned, Sepremi, My Plan. So I think that opportunity showed that, you know, there are gaps of information throughout governments and civil society organizations and manufacturers that require some additional support from a third-party impartial approach. So I think that's quite important. And finally, I think it is important to work throughout the movement. Even though we have different challenges and approaches in these different scenarios, with basically not donor funding for the last 20 years, we've been able to find avenues. We were thinking about outside the box and actually create really good solutions from the movement, from the civil society organizations, towards a real access to contraceptive and sexual and reproductive health services. There are opportunities, a lot of challenges, of course, but I think there are some ways to work together in these difficult circumstances. And nobody needs to create the wheel again. I think the movement across the world has already found some ways to find the solution for these topics.
Thanks so much, Martin. Work through the movement, use the power of the members and the movement. Very, very good advice. Really appreciate those insights. So, Claudette, thanks so much for continuing to be with us. You mentioned in your remarks in terms of the funding gap analysis, and so a key question related to that. What advice do you have for members, colleagues on the line on how to get key data into the hands of decision makers that really make the big tectonic decisions around RH supplies? What can you draw from your Ghana experience about getting that data into the hands of decision makers?
Yes, it's very important considering the fact that in the present era where we are looking and considering private sector also being on board with the fact that there is dwindling resources, that element of domestic resource mobilization has actually come up. But then how will you be able to actually go that route if you do not have enough data or you have evidence to show? That is where the van actually comes in at, because you see, the van actually gives you that analytics of the funding gap for you to see what is actually left after the commitment that you have from any other donors also. Then you can be able to use it in terms of advocacy. Now, for Ghana's story like this, now the conversation actually keeps going on domestic resource mobilization. And then we have our interagency coordinating committee on contraceptive security, where we are able to bring on board the data that the van gives us in terms of shipment data, in terms of funding gap analysis from what our partners are doing out there and all that. And then we are able to bring this to the committee to be able to get their buy-in. When we go out there to even our private sector, we are able to show them from the analytics that even the van gives us in terms of funding gap analysis. And we tell them, like, this is what you actually gain when you actually invest into reproductive health supplies and partnership. And then at the end of the day, we are able to come around the same table to see how we can push for it. As much as possible, it's very important that the van also gives us that data to be able to do our quantification. I mean, the quantification now gives you the supply plans that you are able to actually submit in terms of what you need at which point in time and when it should come. So the van integrated with our Ghana Logistics Information System is very important for us. So we are able to see at a click of a button what we need in terms of advocacy, what we need in terms of making decisions at the right time. So all this actually comes into play, and it's very, very important to us. And the RHSC has actually provided that arena for us through the van, and it's actually very important for us. Thank you.
Thanks so much, Claudette. And as somebody who's attended an interagency coordinating committee on contraceptive security meeting in Accra in person, I can attest to how important that forum is and how crucial good, accurate, reliable data, a lot of which comes from the global goods that RHSC and its members collaborate on, is to those decision-making processes. So the last question, and this is good on timing, I think, that this is our last question. So how do we ensure sustainable Reproductive Health Supplies Coalition funding? Well, it's lovely that our members are asking this question and are concerned about this. There is no doubt, of course, that we're in a very tight fiscal environment, a tight environment in terms of funding for coalitions, for partnerships, for global goods. And yet, as so many of our speakers have said, and our strategy process has reinforced, the need for such a body, a way of working collectively towards ends that no single member can pursue alone, is more important than ever. Arguably, is as if not more important, as I say, than these issues were at the founding of RHSC 20 years ago. So we are very clear on the need for RHSC to make a very strong case for our important collective impact. And so to that end, we've developed an RHSC investment case that we use as a key tool to highlight our collective successes, our collective impacts. We're working constantly with new funders to ensure long-term sustainable funding for RHSC. Good amount of that funding's already in place as of December 2024, just as we move into our new strategy period. So my message is one of confidence, one of encouraging conversations we're having with donors, and one of hard work that myself and the team with our executive committee and our members will be putting in to ensure that long-term sustainable funding. But we are absolutely laser focused on it as never before, absolutely for sure. So with that, at 1 minute to time, I'd really like to thank Beth, the chair of our executive committee, to thank Veronique, all of the team, including Alice and Lucien and Hannah, who've supported this webinar and the strategy rollout process. All of those who worked on the strategy and our key speakers, Claudette, Martine, and Tanya, as well as everyone who joined. So great stuff. We will be back in touch with you for a key program of action engagement. Please do come along for that and really talk about how we're now going to put this 10-year strategy into action. So with that, everyone, good evening, good afternoon, good morning. Enjoy the rest of your day. Thanks a million.
Thank you.
Thank you.
Bye.
Bye.
Thanks, everyone. Bye.